Test 1 2. Michelle. Oh, okay. We'll get a.
Oh, I can be silent. Oh, no worries.
Oh, okay. Um, do you have an agenda for Trent?
Yeah, I was just wondering.
Okay, sweet. Process our folders and then just swap.
Yeah,
um,
Trent.
Swap Trent and Amanda and then make sure that are pulled up. Yeah.
I'm gonna call me. So, whatever you guys think, I'll leave it up to you guys because we're gonna meet again. Yeah, maybe. He's getting me after.
At those ones.
The summary stuff is I have in the past at least give them an update. Let me know. If you guys want to talk about it, I'll be happy to give them an update about what happened and what we're doing.
I'd rather be ahead of the game.
Let me know. Okay, tell her if you want to tell them. We'll tell her.
That you will do it.
I'll be happy to give them a quick. Here's what happened as we know. Here's what we did. Here's where we are because we're required to meet 7 days after Tuesday. Which I think we're on next Tuesday. I thought it was next Tuesday to get all the other information.
Okay.
And I'm happy that he's in place.
Yeah, I mean, I think you do very high level.
Yeah.
Because publicity.
It's on I haven't looked in 48 hours. Initially,
I mean, I got
it
just like within no time. I'm not on the
I was,
police
it was my third,
dispatch.
It was my third after my third night in the ICU. Last night I was busy, so.
And you know, I just
got
had a
texted that
conversation with
morning.
him on Friday. Do you know? I was
No, I
over
didn't.
there at Truewood.
It didn't sense anything. Everyone says.
I didn't either.
Yeah,
I was over at Truewood,
Everyone
and
said
we
there
were
was
just
nothing.
like, because you know when I was over at Community Health.
Yeah, right. Y'all had a good
And so
relationship.
so we were like, you know, and so when they came to me Monday, I'm like, well, are you kidding me? He just seemed to
He
be.
was gonna go to the were picking on this notion that he was going to go into partial program like Monday or
true?
Tuesday.
Is that true?
He'd self-referred himself, and so everyone had felt good that something was moving along and this happened. So, and we can tell them like, hey.
Well, I had heard that he was going to self-refer into getting some help, and I'm like, when? Because whenever when a physician makes that decision, we need to be able to allow them to move very quickly on that.
Yeah, and I think
because it's unusual for a physician to go all the way.
It seems like it moved. We're gonna RCA that kind of thing to find out if there was other opportunities, but it seemed like a whole bunch of people were involved and felt pretty comfortable with it. Yeah, our place.
So he had mentioned Has it been to this level in which
I mean, we can break it.
it's either all or none, either they do it or they don't.
I was going back how many times I've done this.
How many?
I don't know of any in a long time. 20 years ago, I checked stuff.
No, you just go first.
Yeah, I'm just gonna say. I don't envy you guys. I don't envy.
This is woke agenda.
I don't envy any of that.
This is woke agenda. You need to take that off. It's DEI.
I don't envy
I'm like, this is a real world.
I don't envy any of it.
Not whatever our state says. Other regulations.
At some point, you're going to strip us of our ability
Can't hire
to have
anybody.
human rights.
That's right. Are humans involved? It's all AI.
That's right. Hey, Dustin.
How are you? Good.
How are you, Dustin?
I am good. How are you doing?
Everybody take a seat. We will get started. Derek, I'll wait for you, buddy. You tell me when, okay? We good? All right. Welcome, everyone. Been a long time since we've met as a public finance corporation, but very good to see everybody here today. So I was talking with Daphne and Karen earlier, and this project, Ralph and Dorothy will remember, started before COVID. We've been working on this that long. Robert Browder was still here. Robert Early was here, and I just remember all the work that's gone into this, so it's nice to bring it to fruition today and actually see something happen. So I need to get approval of our minutes, which our last meeting was in April. Have a motion from Reverend Emerson, second from Tim. Any question or discussion? All in favor say aye. Aye. All opposed, same sign. That motion carries. Thank you very much. Just in terms of the board chair report, I'll keep this very brief. We were able to get the project closed on 9/11, so some good things happened on 9/11. We were happy to get this thing closed. We will have a groundbreaking later this month, and I'm sure there'll be some more information coming out on that, but on October the 23rd, we will have a formal groundbreaking. And you know, going back through the history of this, Blake had called me earlier and said, "Why did we change the name?" And I knew, and I had forgotten. It had been so long. But this address is actually not on Magnolia, and so the project was called Magnolia Lofts, even though the address is on Crawford Street. So when the name change came about, it became Thrive, which is a cool social determinants of health word. Worked out great, so the reason for that is it's on Crawford, so that'll be the formal address. So if you still have that question, hopefully I've answered it. I don't think there's anything else. Daphne, we're going to have a report from, is Max going to present his slide? Max Whipple is here today. Max, good to see you, sir, with NRP. He is the Vice President of Development. Been working on this project a long time, has done several other public finance corporation projects of similar stature around the state. So Max, welcome. Be happy to hear from you.
All right, am I live?
Sure.
Welcome. Thank you all for having me today, Chairman Petty, Dr. Duncan, and board members. It's been a long journey. I remember sitting in this conference room, I think 4 years ago, but we're very excited to be here today with the project just down the street under construction. So I know there's been a lot of new board members and folks here, so we've prepared a little bit of a presentation that will go through just kind of high level who we are as a company and the project itself. And kind of talk about some of the next steps as we continue on through construction. So with that said, this is, again, here's a rendering of the project, Thrive on Crawford. A little bit about NRP as a company. We were founded in 1994, but we've been in Texas since 2004. We've developed over 30,000 units across the state of Texas, the majority of those units being affordable housing, and the majority of those units being public-private partnerships. So a lot of the work we do is with local municipalities, cities, counties, housing authorities, but we also have started to explore these kind of non-traditional housing partnerships. So we're working on another partnership with the Austin Independent School District currently, as well as a couple of other, again, non-housing entities that we're exploring across the state. We are active in now it's actually 17 states. We've started to branch even further west, but the majority of our development activity is really based here in Texas. As you'll see on this slide, again, we've developed 30,000 units kind of all across the Metroplex, within San Antonio, within Austin, within Houston, but also scattered kind of across the rest of the smaller cities as well. We have over 450 employees across the state. We've developed over $3 billion in real estate across the state. And have an expansive pipeline continuing to grow as well. One thing I do want to highlight just about our company that's a little unique from a lot of developers is that we are a vertically integrated shop. And what I mean by that is we handle not just the development phase, which we've kind of passed at this point, but we also are responsible for construction and eventually the property management of this asset. And so what that means is, I like to say the buck stops with us, and that, I've been working with Daphne on this for 4 or 5 years and Trent as well, but they have my cell phone number. If there's an issue that occurs during the construction phase or the property management phase, I will be a resource, our team will be a resource to help address those. Obviously, we hope that there aren't any issues, but cognizant that with, our project and obviously all the work that's going on at the hospital, there may be construction coordination issues or things of that sort. And so I've been already very involved with, kind of the early construction phase and making sure that we're kind of out of everyone's hair, but we'll continue to be involved throughout the construction phase and eventually the property management of this property. Want to just touch on a little bit about healthcare and housing. So, we actually started exploring these partnerships prior to COVID. It really started up in our main office up in Cleveland, Ohio. And so the project you see here is called Residences at Career Gateway. It's based in Columbus, Ohio, and was a partnership with Nationwide Children's Hospital. So it's similar to what we're doing here, but their real partnership in the project was kind of limited to the commercial space that you see there. They chose to use that space as a job training facility for new hires at the hospital. So our real focus on this, though, has been, how can we bring more than just housing to the table? We try to provide these wraparound supportive services, but also how can we kind of, blend housing with some of those other social determinants of health, like Mr. Petty was saying. And so access to healthcare, providing some of those healthcare services at the property is something that we're really excited about with this development here. By way of background, this property was initially RFP'd a handful of years back, and that's when we found out about this through the folks at Wynn Jackson. This site scored very competitively for what's called a 9% housing tax credit. These are done all across the state. It's about one competitive application cycle per year. They fund about 50 out of 250 applications across the state. So it's a very, very competitive process. But this site scored very competitively because of its location, because of its proximity to jobs, transportation, and a lot of those essential services. And so we applied for those funds in 2021 and were successfully awarded those funds. And since that time, JPS has formed this public facility corporation and moved forward with participation in the deal. And so the project is funded utilizing those low-income housing tax credits. It's also utilizing funding from the Near South Side TIF and traditional construction loan as well. So here's kind of an illustrative site plan of the project. The project will provide 67 total units. 60 of those units are affordable for folks earning up to 30%, 50%, and 60% of the area median income. And just to talk about that very high level, area median income for these affordable housing projects is based on the metropolitan statistical area. And so it varies, from Fort Worth to Travis County and Austin, all across the state. But the rents for these units will be the rents and the incomes for these units will be restricted to folks that kind of fit within that criteria. So we're looking at really folks that make anywhere from 30 to 40,000 all the way up to 60 to 70,000, kind of fitting in that criteria of 30-60% AMI. There's also a handful of market rate units that was driven by the city of Fort Worth's tax credit process and their requirements within there. Additionally, what we're really excited about is providing the retail space, which I'll talk about on the next slide here. Here's a rendering of the project. So we are located within the Near South Side, which offers some pretty cool opportunities with their local zoning code. So you'll see we've got front porch entrances for some of the units along Magnolia there, and we're hoping to kind of connect to a lot of the activity that's happening further west along Magnolia. So the commercial space here, it's just over 2,200 square feet of space. It's going to have its own dedicated entry off of Bryan Avenue. There's really no fee paid by the hospital district. There's a very small portion of common area maintenance fees. I think it's like maybe $200 to $300 a month, but there's no rent that's paid by the hospital district, right? So this can be used either for further development on your own side, or it could turn into another revenue opportunity as well. We are providing a warm white box build out, and what that means is electrical, plumbing, utilities will all be readily available, so that whether it's yourselves or whether it's a subsequent tenant, they would be able to just kind of plug and play with whatever their use may be at that time. Some of the amenities that'll be available for the residents, you can see here. This is something we've really focused on, especially in, kind of this post, if we want to call it a post-COVID world, but really, especially as a lot of folks are working from home, dedicated business centers and co-working space is something that we're looking to provide here, along with what we typically provide within the fitness center, community room and kitchen. There will be an outdoor gazebo with grills. But then what you'll see within the units is very similar to what you see at all of your luxury apartments across the town, right? So you're going to have granite countertops. We're going to have that traditional vinyl plank flooring, and cabinets, walk-in closets. A lot of those same amenities are going to be provided in these units. And then what I'm most excited about, we are really proud of, is if you look in the bottom left corner, that is an example of one of our children's activity rooms. And so that is a dedicated space where we'll have an on-site supportive services coordinator that will watch the kids after school from about 3 to 5. So again, a lot of the folks that will eventually be living at this complex most likely are working 9 to 5 jobs, something of the sort. And so, it's not always easy to get home and have someone to take care of the kids after school. And so that is a space that we provide, supervised space that we provide that's available to the residents, and it's available free of charge, right? So it's inclusive of their rent, along with a lot of this other services that I'll talk about here in a second. So on that note, we partner with a community nonprofit called CHR Partners. We do a lot of work with them all across the state. They then work with a lot more like hyper-local community nonprofits. And so we have a list of about 35 different services that they can provide to the residents. Again, all of these are free of charge, but what we like to do is once we're about 40 to 50% leased, we'll actually survey the residents and say, okay, which of these services will be the most useful to you? We will always provide the child care services. That's confirmed. We will be providing that. But, we can kind of tailor the additional services based on what makes the most sense. So if we have a lot of folks that say, okay, this is a temporary solution for me, I'm looking for, to move into a home after this, we can really emphasize the first-time home buyer, classes and support for the residents. This is a exciting partnership in that the equity through this deal came through a partnership of CVS Health and Aetna. And so they're really excited about the opportunity to provide biannual or semi-annual, healthcare screenings at the property for residents, again, free of charge. So again, that's something we're looking to tap into, is kind of not just providing the housing, but providing a lot of these wraparound services as well as, access to healthcare as well. So again, those, as we start leasing up the property, that's something that we will be surveying the residents to see how we can provide those most beneficial programs. So here's high level, just a timeline of where we are at. So as Mr. Petty mentioned, we closed on this project finally in September and broke ground in construction shortly thereafter. So they've been out there working the last few weeks. We have a groundbreaking celebration scheduled for October 23rd. And from there, really, construction is going to continue on for the next about 14 months with the goal of completing construction at the tail end of 2025. And so really what we will start to do as we get into early to middle of next year is that's when we kind of start ramping up our pre-leasing campaign. And so that's when we'll be working with some of the folks on the communication side here at JPS to make folks employees available of when those units will be available and kind of some of the qualifications they need to make in order to rent those units. So we are not able to set aside those units for JPS employees, but we plan to continue to communicate and coordinate with JPS staff so that everyone is aware of when those units will be readily available. Yes, sir.
Sorry, waiting somebody else.
But again, we're looking to wrap up construction tail end of 2025. It might slip into the beginning of 2026, but that is kind of our timeline on the construction. We're estimating about a 3 to 4 month lease up period. My guess is just because of the location, because of the demand, this project will probably be leased up within 30 days of the doors opening. And that's what we've typically seen with projects in similar size, in similar kind of denser areas like this one. So with that, I believe that wraps up my presentation, but I'm happy to entertain any questions. But again, thank you all for the partnership. We're excited to see this project built. Again, this is a very exciting partnership. We do a lot of work with housing authorities, cities and counties, but not very frequent that we get to do these non-traditional housing partnerships. So again, appreciate it and looking forward to seeing this built and the celebration in a few weeks.
Max, thank you very much for being here. Appreciate all the work and the patience that you guys have put in, because this has been a very long process. But NRP's been a great partner. Obviously, very high quality products, can offer some housing down here that we hope will benefit our own folks, especially our residents and some of the folks that we have really encouraged to have housing closer to the campus. So with that, let me open up for questions. Ralph?
Can you give me the median income again for affordable housing?
Yes, sir. So the area median income for Tarrant County is roughly $100,000 for a family of four at this point. Compare that to some of the other counties across the state. You know, Austin is around 130,000, Houston's probably 90,000, but Tarrant County is a little bit higher than some of the other counties across the state. So the units will be set aside for folks earning up to 30%, 50%, and 60% of the area median income. And so these units will be set aside for folks kind of in that $30,000 to $60,000 income range.
So you'll have financial individuals who will assist in that area?
Yeah, so we have an in-house compliance department that, you know, reviews files and ensures that we comply with, you know, the state regulations in terms of affordability. And also our tax credits are reliant on providing those affordable units as well.
The other thing is I want to just bring your attention to, on the site, you show the outdoor playground. Just be careful that there is a health hazard with that. Putting outdoor playground equipment that's not shaded in Texas.
So there will be a small shade structure over the facility, and then there's an adjacent to the playscape itself, there will be a little gazebo grill area that will also be shaded as well. So we try our best to provide that where possible, but you know, obviously we can't completely shade the whole space. So.
Well, that's why McDonald's moved all theirs indoors, because it became a health hazard.
Other questions for Max?
Can you explain the name change?
You missed that. We had that whole speech. We had that whole speech for your benefit. You weren't here.
Not called the Woodard.
Yes, I'm happy to go through it. So the actual formal address for the property is located on Crawford Street and not Magnolia Street, Magnolia Avenue. And so that was kind of one of the main drivers for the change. But additionally, we were kind of brainstorming different ideas and looking at how, again, this project's intersection of healthcare and housing. And so Thrive, kind of looking at, well-being, healthcare focus is kind of the idea of why we switched from Magnolia over to Thrive.
So we had talked, to all of us, it's always been Magnolia Lofts, because that's what it was in 2020. So, but we had actually talked about the Thrive name. I'd forgotten about it. It'd been some time ago, but made sense. And then when they told us about the 911 addressing of the building being on Crawford, Magnolia Lofts didn't really make much sense. So that's why we ended up with Thrive.
We did discuss, and I didn't hear that, about priority when it comes to JPS employees.
We did discuss this. There's no way that they can, under federal law, set aside units for JPS employees or residents. However, it doesn't prevent us from marketing the project to our residents and to our employees so that they certainly have a good shot at getting in there. We just can't segregate that and make it a separate JPS only, because that violates the federal housing rules.
I was curious about parking. I didn't see any parking in the diagrams. Is it street parking, or is there going to be a garage?
I think my clicker died here, but if we can go back to the rendering slide, there is street parking that will be dedicated solely for residents of the project. Typically in an urban location like this, kind of the city, they actually don't have a parking minimum. You're able to get basically down to about half a space per unit. We don't think that's sufficient, especially in an area like this. We typically try to provide closer to one space per unit, but this community actually provides close to 1.2 spaces per unit that will be set aside and reserved for residents of the community. We're also going to be providing street parking that was, as we permitted the project through the city along Bryan and Magnolia as well. So I don't know that that's reflected on there, but those won't be dedicated spaces, obviously, but there will be additional parking opportunities both for the commercial space and for additional residents or guests.
Is the parking that's on slide 14 the way it's going to be? Is that
Yeah, Derek, go back to slide 14 if you don't mind. And I can tell you that in this part of Fort Worth, you're given credit for off-street parking allowance. You don't have to have one-to-one, and that's not uncommon in a highly urbanized area where off-street parking credits are allowed as a submittal for your parking requirements, and that's the case here. There we go.
Yes, so that is the layout of the community and the parking facilities. Yes, sir.
Any other questions for Max?
Yeah, Trent, I've got a question. For you. So does NRP actually own this asset? Okay.
Well, and the answer is yes. However, it is a number of entities involved in this, and I will, as attested by the 3 hours I spent signing documents. But Daphne, do you want to answer that question regarding
Max, you
specific
can jump
ownership?
in, but actually there's a limited partnership
I see.
that owns the asset. We own a small percentage through our participation as the general partner, and mostly it's NRP and NRP investors that have the largest share of the equity in them.
Understood. So did we contribute the land for this, it looks like? Okay.
And contribute. I mean, we're actually leasing.
We're
it.
leasing.
I see. Okay, so we've got a lease. I got you.
So we
Okay.
get, there's a fee.
Yeah,
There's a
makes
fee
sense.
that comes back to JPS for building the project. There's a proportionate share of rent. We waterfall down below the lien, but I mean, we have a portion of the rent.
Gotcha.
And we also have at our disposal the commercial space.
Okay.
We can decide what we're going to do with. So a lot of time spent really trying to negotiate this in a way that was a financial positive for JPS because it always needed to meet our goals of providing additional revenue streams.
Gotcha.
And so that process has been kept in place from the very beginning. So it's a revenue positive for us, but not only that, it also provides us the badly needed housing piece of it. And Karen, do you want to talk about, I'm not sure how far we are down the road in terms of the utilization of the commercial space. I know there's been a couple of different ideas, but is there anything new on that?
No, we will, to Trent's point, we will crosswalk it with some of those barriers that we see within our communities to see whether there's opportunity for us to fill that space and be able to close some of those gaps, those social determinant of health gaps. We've talked about maybe even a grab and go within there. Finance, we're working with finance right now. We'll kind of model it from a revenue standpoint as whether it makes more sense for us to sublease that space or whether there makes more sense in us kind of building our own business there that would generate some revenue. So.
Some of it may depend.
And we'll
too, on
crosswalk
our
with
mix.
what other services are already in there. We wouldn't put childcare in there if there's already a childcare kind of space.
I think we probably want to wait to see what our resident mix looks like. If we end up with a bunch of JPS employees and residents, then that's probably a different utilization opportunity.
Yeah,
for that
Max,
space.
your meetings with those residents, I heard you say at about 50% capacity, you'll be meeting with them to see what their needs are. We'll also be able to provide us some information as to whether we could generate revenue from some of that need, so.
Absolutely. We're happy to, have our property management folks kind of survey the residents on that as well. So just as a high level, in the past, we've done spaces like this in Austin where we had a community nonprofit come in and we broke the space into two different spaces and provided one of them was a healthy bodega kind of pay as you can, and the other one was used as a community barbershop. So there's a lot of different options, but that's what we've done in the past. We've done a lot of these kind of commercial build outs in the past. So really the opportunities are endless, so.
Just don't count out McDonald's, baby.
Always has a way of, they somehow to always get back in the agenda. I don't know how they do that, but they do somehow. All right, other questions for Max?
That sounds like a great project. Thank you both.
Yeah, this has been a lot of work, but Max, thank you for your patience, and our attorneys, Bracewell, Daphne, has spent tons and tons of hours on this, and her staff, as has Karen, so thank you, staff, for being diligent. Lonnie, bringing me back for 1 million signatures. A lot of work involved in this, and but it's going to be productive, it's going to be beneficial, and it's part of what we at JPS have embraced in terms of how we diversify revenue streams and how we look at JPS's overall role in the community. Clearly, we play a role that goes beyond healthcare, and proud to be a part of this. So, Max, thank you for being here. We'll look forward to the groundbreaking and the ribbon cutting, and look forward to our invitations. In the meantime, let us know if we can help you.
All right. Thank you all. Appreciate the time today. Have a good one.
Thank you, sir.
Thank you.
All right, Daphne, do we have anything in executive session? Okay, with no further ado, it's 1 o'clock, and we will declare this meeting adjourned and get ready for the board meeting. Thank you all for being here. We appreciate it. I did that. That just worked out pretty good, didn't it? Sure. This minutes?
Oh, wait, this is the wrong one?
Thursday, April 11th. Oh, that was a long time ago.